When we put together this conference in the program, we had really three objectives in mind. One was to enhance your knowledge of malaria and where the science is headed. The second was to ignite a sense of inspiration in you and an awareness that you are part of the solution, we are all part of the solution. And the third was to expand your awareness of the role Rotary plays in the malaria eradication effort. So those are the three objectives. Keep those in mind, and we'd love to know how we did in delivering on those objectives at the end of the day. So without further ado, I'd like to introduce Perla Koro, who is going to introduce our keynote speaker.
Good morning. My name is Ijoma Perla Koro. I'm of the Rotary Club of Port Harcourt, Nigeria. I currently serve as a trustee of the Rotary Foundation. And of course, if I say I come from Nigeria, you know that I come from a place where this lecture is so badly needed. There's hardly any day I'll sleep without seeing a mosquito, no matter how much I try. So I'm committed to a polio-free, committed to a malaria-free Nigeria, and I want to thank all of you for being here. Well, my job is simple, to introduce someone who is a great African who has been so committed to the work of Rotary. He's been a Rotarian since he was a little boy. As an interactor, grew up to be a Rotaractor, then a Rotarian, and he served in so many boards. But one thing I really like about him is the fact that he's so deep-necked in corporate governance. The person going to speak to us now wants to do everything right, especially when it comes to corporate governance. He served Rotary in so many capacities. He served my Zone 22 as a director, and just recently, he was a member of the member at large for this just concluded COL. We are told to be mindful of abbreviations, so COL means Council on Legislation. So without much ado, fellow Rotarians, please help me to welcome Patrick Chisanga, past Rotary International Director. You'll give me an impression of his voice by the time he's done.
A very good morning to you all. I haven't had too much of a morning because my plane landed in Calgary at 3 o'clock this morning. And I've had some sleep, a whole 2 hours of sleep, straight from the plane. But just the thought of coming to this conference has given me so much energy. So I'm ready to go. Let me once again say good morning, distinguished delegates, esteemed colleagues, and I've had the opportunity to meet quite a few friends and colleagues that I have not seen for a while, that we have met in different parts of service world. Our valued partners, and there are so many here, in public health, and my wonderful Rotary family. It is a great honor to join you today at this Global Malaria Congress, a gathering of visionary leaders as I see them, and I also know that in the room there are many technical experts and change makers united in our mission to end one of the oldest and deadliest diseases, malaria. I bring warm greetings from the Rotary family, a global network of over 1.4 million members committed to creating a lasting change in our communities around the world. I stand before you today, ladies and gentlemen, as past director, as Ijoma introduced me, of Rotary International for Zones 21 and 22, which includes the vibrant and resilient continent of Africa. The very front line of the malaria fight. That is where we are hit most. When the invitation came for me to speak at this Congress, I was still serving as director on the board of Rotary International. And it was clear that Rotary's voice, especially from Africa, had a vital role to play in shaping the global malaria agenda. Today, I also speak from a national platform as a committed member of the End Malaria Council of Zambia, where I serve on the board of directors. And the president of Zambia is the patron of that organization. That's how important we attach to this fight against malaria. I work alongside government and civil society leaders to drive strategic investment, accountability, and innovation in malaria elimination. My dear colleagues and friends, in my view, malaria is more than a disease. Malaria is a thief. Do you know what a thief is? Yes. Malaria is a thief. It is a thief that steals health, hope, potential, and progress from our communities. I'm sure you know this, that every minute a child dies of malaria somewhere. Every year, over 200 million people are infected, and Africa bears more than 90% of this burden on our shoulders. In my view, this is not just a health issue. It's an economic, educational, and social crisis. And yet, malaria is preventable. And yes, it is treatable. And with collective action, I believe it is beatable. Let me now reflect a little on Rotary's legacy in global health. Rotary is no stranger to fighting diseases that devastate communities. Our journey with polio eradication stands as one of the greatest global health partnerships in history, believe me. We have reduced polio cases, and you heard Trustee Ijoma, whenever she stands up to speak, she cannot fail to get polio into the way somehow. And she says, we are not done yet. But we have reduced polio cases by over 99.9%. And we have helped to build surveillance, laboratory, and response systems that today benefit malaria programs. Now, we are applying the same principles of community-based action, strategic partnerships, and sustained funding to malaria, as we did to polio. And we are beginning to look beyond malaria through the Rotary Health Communities Challenge, which many of you would have heard about by now, a Rotary-led initiative now spanning 4 countries in Africa, we are working to reduce severe cases and deaths caused by malaria, pneumonia, and diarrhea. Diseases that continue to claim the lives of far too many children under 5. This integrated approach recognizes that these illnesses often occur together and can be tackled more effectively through unified, community-driven health challenges. It is a bold shift from disease-specific interventions to people-centered care. And Rotary is very proud to be leading the way. Rotary is not a one-year donor. I want to tell you that we are lifelong partners. We are lifelong partners. Our investments are not just financial, they are personal. Personal. Rotarians, we Rotarians, give our time, our networks, our credibility, and our advocacy. We work with communities. We hold governments to account, and we elevate local voices. Building on this foundation, the Rotary Health Communities Challenge is now demonstrating what is possible when communities are placed at the center of healthcare delivery. The initiative that I've just referred to, active in 4 countries at this point, has reached over, believe me, 2 million people with a clear and urgent mission. And this clear and urgent mission is to reduce severe cases and deaths from malaria, pneumonia, and diarrhea. The leading causes of mortality in children under 5 across sub-Saharan Africa are these 3 diseases. By training and deploying thousands of community health workers, Rotary is bringing primary health care directly to people's doorsteps. This approach is not only saving lives, but also shifting how health systems respond at the grassroots level. During his recent visit to my home country, Zambia, we took then RI President-elect Mario. As you know, he had to discontinue his journey in Rotary at that level. But when he came to Zambia just a couple of weeks ago, we took him into some villages for him to have a personal experience of this initiative. And Mario actually offered to be treated for malaria, rather to be tested for malaria. 2 different things, isn't it? He asked to be tested for malaria, and he was tested by one of our locally trained community health workers. And you know what? You know what the result was? You're right, it was negative. So, in Zambia, where the journey began, our efforts laid the foundation for a transformative shift in community health. Thousands of community health workers were trained and deployed not just to treat malaria, but to deliver primary health care closer to the people. The ripple effect has been amazing, has been substantial. It created a foundation of the Rotary Health Communities Challenge and is now demonstrating what is possible when communities are placed at the center of healthcare delivery. This approach is not only saving lives, but shifting how health systems are responding, as I have said, at the grassroots level. Past RI President Jennifer Jones, who I believe will be joining us sometime later today, according to the program, came to Zambia. Jennifer came to Zambia 3 years ago to kickstart Rotary's involvement in the fight against malaria under the Rotary's very first program of scale, which brought together $6 million from Rotary and our partners and ingested it in the Zambian challenge. I want to tell past President Jennifer, in case she's not here, I'm not here when she comes, I want her to know that, and she should feel gratified to know that the program that Jennifer Jones initiated is bearing tangible results in significant reduction in mortality rates. Statistically, the figures we are having from the people who maintain statistics show that mortality rate from malaria in Zambia has dropped, believe me, by around 20% over this period of time. Against this background, my dear friends and partners, wonderful Rotary family, I'm very proud to be able to state today that globally, Rotary's engagement in malaria has attracted new partners. And my eyes are itching to hear and to listen to what our new partners are going to say. I believe some will happen somewhere along the way in the next few days. We have the Gates Foundation, or we're the partners, World Vision, national governments, and many others, proving that when Rotary leads, others follow. In concluding my remarks, I do not wish to offend the moderator. He gave me 10 minutes, so I've done 7 now. In concluding my remarks, I wish to end by making a call to action. I believe that this is how we will turn the tide against malaria in Africa. And there is no doubt that the tide is turning. But it needs all of us to push harder. To my fellow Rotarians in the room and across the world, I'm saying, let us elevate malaria on the global Rotary agenda. Let's make malaria, and I say this very boldly, let's make malaria our next great cause after polio, Ijoma. Is that possible? To global donors, I ask you to trust in grassroots partnerships, because that is what works, grassroots. To governments, my message is honor your pledges and protect your people. To young leaders, and I've seen quite a few, I'm saying this is your fight too. Bring your innovation, bring your energy, your agency into the battlefield against malaria. My wonderful Rotary family and friends, I sincerely and passionately believe that together we can transform malaria from a death sentence into a historical footnote. I thank you.
I think we can appreciate him better. Thank you, Past Director Patrick Chisanga. I think the message is very, very clear. Let us join hands together to elevate malaria so that it will be our next focus after polio. So what that means is that we all need to join hands to ensure that we eradicate polio from the face of the earth. Because until we eradicate polio, we are not going to embrace any other health concern solely. But the earlier we eradicate polio, the better for all of us. Thank you so much.